I'm CJ Smith-Dio. I'm a family practitioner at Monroe Clinic. I chose to go into osteopathic medicine for mainly two reasons. It tends to take a more holistic approach, taking a look at the patient as an entire being instead of a series of body systems. I think it gives us a little more familiarity and comfort with manipulation, musculoskeletal medicine, physical exam in general. I think the manipulation part of it, which is sort of like chiropractics, in fact it predates chiropractics, again is an extra tool that we can use in helping patients. Something that about myself that people might be surprised about is that I'm short. No, most people know that. I like to play soccer. I play at the Y frequently. I like to garden at home. My wife and I have 3 wonderful kids. We live out in the country. I don't know, I think people will be surprised that even though I look stern, particularly in the morning, that I actually have an acceptable sense of humor. I help my patients get the best outcomes, I think, really through education. People come into the office and have multiple medical problems, and I think sometimes there's not much of an understanding of what's going on in their bodies. There's not much of a concept of primary care, primary prevention, what can be done at home to maybe delay the complications of some of these diseases, maybe even delay the initial diagnosis. I think education is the primary goal in primary prevention, in primary care. I mean, that's the key there. My patients can do a variety of things to help manage their health. I think the number one thing they need to realize is what they do early on in life will determine how their golden years are going to be. If their cholesterol is poor, they need to treat it. If they're overweight, they need to get their weight down. If their blood pressure is poor, it needs to be taken care of. I think people get into the mindset if there is no symptoms now, it's not worth addressing. The community and residents here in Monroe benefit from having Monroe Clinic here because I think for a community of this size, it's a fairly progressive hospital system compared to a lot of places out there. I think having electronic medical records, the hospitalist program, the Da Vinci surgical system they have here, building a new hospital, I think they're all signs that the hospital's doing well. I think they're forward thinking, and I think it's clearly the surrounding community's very, very fortunate to have a hospital of this forward thinking.